Hello, this is Miss Evelyn with the CNM Veterinary Technology Program, and I am here today to um, discuss the medical terminology part in week 1. We call this part 2 because the first part was the introduction, which for your class actually occurred through the Collaborate Ultra session. And now we're going to look at the main content that lines up with chapter 3 of your textbook, Clinical Veterinary Language by Joanne L. Colville and Sharon A. Oline and chapter 3. So make sure that you refer to your textbook as you go through this. Again, some of the pictures may show up on your, indeed on the test, so make sure that you are in touch with what the pictures are really doing. So in medical terminology, location is really important, and we need to build a unified way of explaining our animals' terms as we work with each other in any kind of restraint situation. So it's important that the positional terms are accurate and concise for describing all of our body locations and relationships from one body structure to another. So we start off looking at this chapter even before we start breaking apart medical terminology terms, because it's important to start building a common universal way of describing the areas and the positioning of our patients. So when we say things like forward, backward, up or down may not always be the best way in our veterinary medicine. So there is what's called the standard foundation for anatomical directions. So there are 4 standard foundations. One is called the SAP, the Standard Anatomical Position. And then we have anatomic planes of reference. So both the words, of course, anatomical, anatomic go along with the word anatomy of our patient. In situ is how the animal actually looks. And then we actually look for the animal's right and left side. So consider yourself when you are looking forward and you have what's your right eye, your right arm, and your right leg. The same way with our animals. When they are looking forward, that is their right side. The same way as us. It's not how we look at the animal, it's how the animal is sitting on their 4 legs or laying on their belly as a snake would, and they still are looking forward. And you look from as if you were the animal's right and left. A lot of times with dealing with directional terms and planes, we actually start off looking at our own body. And it's really a way that we deal with anatomical and anatomy and physiology study anyway. Even if we are in the animal care field, we look and relate everything to the person, to a human being. So planes, as we use that, P-L-A-N-E-S, and these are not the items that fly in the sky, but these are planes of reference that we, in a sense, cut the body apart with these invisible planes. So they create sections that provide the foundation for other major directional terms. And as you look at the picture, and again, coordinate it with your textbook, but there are 3 major planes that are perpendicular to each other and together form a 3-dimensional configuration. Those planes, as you can study the picture on your own, is the median plane, or we also sometimes call it the median sagittal plane, a dorsal plane, which is toward our rear side, and a transverse plane. So look at the picture and there's also the frontal plane. So we're going to pull some of these apart. So when we say planes, the median plane divides the body into equal right and left sides. Or we also call it the mid-sagittal. M-I-D-S-A-G-G-I-T-A-L. And I always recommend that you pronounce some of these big words or pronounce these words with me. Um, it is a little hard in the online environment to make sure that your tongue is getting all that word out, but practice it on your own as you are watching this, mid-sagittal. So that median plane, again, divides the body into equal right and left. Equal is the thing. So you can see it here with the picture of the kittens. And remember, you may see some of these pictures on a quiz and be asked what plane is being represented. The sagittal plane can also yield unequal right and left portions. So it's important to understand the median plane is equal, a mid-sagittal, but then also just the term sagittal plane can yield unequal right and left sections. And then we have the difference between a plane versus a direction. So we have a medial plane, which divides it in that equal right and left sections, or the mid-sagittal plane. And then we also have, when we look at like a limb or something, we will say that the part of the kitten's front leg that is closest to the blue line would be considered the medial side of that leg, and the part that is furthest away would be considered the lateral direction. So medial, again, can also refer to a direction as far as an inner portion of, let's say, a leg, or a lateral side being the outer portion. So medial is toward the midline, lateral away from the midline. So then when we look at other planes, you have what's called the frontal, or it's also and dorsal and coronal planes. So these divide the body into front and back if we're looking at bipeds. So a person is a biped, and our quadrupeds would be our dogs and cats and horses and sheep and cows, okay? So a frontal, dorsal, and coronal plane divides them into front and back. So the frontal plane would be more toward the person's head, and the dorsal is toward our rear end and our back side, our spinal area. The ventral would be in the midsection of our human body there. So we got a frontal plane and a dorsal plane. And then we also have the quadruped. It divides it in a top and bottom. So dorsal would be toward the animal's backside, and the other plane is toward the animal's abdomen. So dorsal and ventral, we call it. So again, we have a human with the frontal plane to where the face is, ventral, or they call it even anterior, toward where the belly of our human is as they stand, and dorsal on the human is where the back and the rump is. And then when we look at our cat and we divide that plane, the dorsal is toward the back of the animal, and the ventral is the belly. And anterior pertaining to the front or before, the front part or the before part. Posterior pertains to the back or the behind part. And then dorsal pertaining to the top or the back and the ventral. These terms become very important in our animals when we need to put them into a restraint position and we're trying to make sense and talking with someone else. So again, planes versus direction, we have our human there, but frontal, dorsal, coronal planes can also divide the feet into top and bottom sections. So the dorsum is the upper surface of that entire body or the body part. So if you have, looking at a foot, the dorsum is as the arrows show it, and then you have in the front feet, it would be palmar, as in palms of the hand, palmar, and that would be the bottom of the feet of the, and the plantar is the bottom of the back feet on our quadrupeds, and plantar, of course, on our bipeds for our bottom feet. So terms to understand: dorsum and palmar and plantar. Some other planes that we look at, we have a transverse horizontal cross-sectional plane. And this will divide the body into top and bottom sections when we're a biped, or into front and back sections. So if you can imagine the cat standing up on its hind legs, those lines are actually going then in the same way. So we have our front and back sections. These are transverse planes. And you can also see that we can have transverse planes and horizontal planes on our legs. So the transverse and horizontal cross-sectional planes, they're reference points in our superior and inferior bipeds. They are reference points, or they're cranial and caudal. So notice cranial toward the head, the cranium, caudal toward the tail, the caudal area of your patient. So plane versus direction again. And again, the term superior is pertaining to the uppermost, above, or toward the head in our bipeds. Inferior pertains to the lower part in our bipeds. So if you were looking at a great ape, you might actually utilize those kind of terminologies. And then cranial pertains to the head or the skull, that direction, and caudal pertaining to the tail. So we have some other terms that we need to understand when we are talking about our animals. So the following directional terms do not reference a plane, but they describe toward the center or away from the center of the body. So rostral, R-O-S-T-R-A-L, rostral, toward the tip of the nose, if it's referring to the head. Proximal is a position on a limb that is closer to the point of the attachment to the body. And distal is further away. So if we look at this puppy in the picture, his paws, the white paws, are distal from the rest of the body. And where the elbows are, or the shoulders, that would be the proximal part of the limb. So distal versus proximal. Superficial or external versus deep or internal. So superficial, external, toward the surface. If this puppy again had a lesion right on top of his head, well, that would be on the superficial or external part of the hair coat. But if he had a growth inside his abdomen, that would be deep or internal. So toward the center. So keep these terms in mind: rostral, proximal, distal, superficial or external, deep or internal. That finishes some of our directional terms. Now we look at body cavities. So when we talk about cavities, we're talking about what is being held inside the hollow space of the body, and the body itself and the structures are protecting those internal organs. We have a picture here of the human. We have a cranial cavity. We got a spinal cavity. That makes up the dorsal cavity, the spinal and cranial area. And then in the ventral cavity of the human, we have a thoracic cavity, we have an abdominal cavity, and a pelvic cavity. You kind of see how those are illustrated in the picture. So how do these play out in our animals? So when we talk about body cavities, so the two main primary cavities is the difference between the dorsal cavity and the ventral cavity. So if you have a stuffed animal near you, or a real animal, you may want to start putting your hand on that little critter and be saying these terms to help your memorization by touch and feel, and being able to actually put these together by a tactile area and say the dorsal cavity is right along the back end of my animal. The back end, and the ventral is underneath. So again, the dorsal cavity has two subcavities. You need to understand all these. You may want to try to outline, make this into an outline, and put it down in your own picture words how all these terms go together. But the dorsal cavity has the cranial cavity, which holds the brain and so forth, and the spinal cavity with the spinal column, spinal cord. And you can see the terminology on this slide. Cranial cavity contains the brain in the skull. Spinal cavity contains the spinal cord within that spinal column. The ventral cavity, and it is made up of two subcavities, are thoracic or chest. Thoracic is a more definitive term. And abdominopelvic cavity. Right? So the thoracic chest cavity contains our heart and lungs within the ribs and between the neck and the diaphragm. And then the abdominal pelvic cavity contains most of the organs of our digestive tract and reproductive area. So looking at our thoracic or chest cavity comprises two subcavities again. We have one that's called the mediastinal cavity, mediastinal, and the pleural. So the mediastinal, median, right in the middle, contains basically our heart and the major vessels, and the pleural cavity surrounds it with the lungs. So again, the pleural cavity contains the lungs within what's called the pleural membrane, and the dividing line is our diaphragm, the muscle that divides the thoracic cavity from the abdominopelvic. And the mediastinal cavity contains the heart and the pericardial membrane. So two. All these twos of cavities. We're down to our last two subcavities. The abdominal pelvic cavity has two subcavities called the abdominal cavity and pelvic cavity. The pelvic is a little bit smaller in most critters. So the abdominal cavity contains the major organs of digestion between the diaphragm and the pelvic, or this is also called the peritoneal cavity. And then the pelvic cavity contains the reproductive tract and excretory organs formed around the pelvic bones. So understand how those cavities come together. Look at your textbook, and we're down to the last couple areas about lying around terms. Know how to spell the word recumbent. That is the medical term for when an animal is lying down, or a person, means that they are recumbent, R-E-C-U-M-B-E-N-T, recumbent, or in recumbency. And the recumbent positions are described by the body part that is being laid upon. Sometimes this is a hard one for students to remember. But if we talk about a dorsal recumbent animal, and again, I would really pay attention to these photographs, because I can readily have these on a quiz. But when it is dorsal recumbency, B-E-N-C-Y, it is lying on its back. Ventral recumbency is lying on the belly. When it is left lateral recumbency, it's lying on the left side, and a right lateral recumbency is lying on the right side. So when we talk about the term recumbent, it is what part of the body is on the surface, touching the surface. This is critical actually in surgical positioning and radiological positioning. But dorsal recumbent, lying on the back, ventral recumbency, lying on the belly, left lateral recumbency, lying on the left side, right lateral recumbency, lying on the right side. With this recumbent position slide, you have finished your planes and directions and body cavities. Enjoy putting these terminologies into use. Again, I highly recommend that you take a physical animal of your own, or even better yet, some model, a stuffed animal or a hard animal of some sort, model, and put some of these terms along that animal and put your hands on that model and be saying the terms along with it. It will really help your memory with putting these into action. Enjoy looking at chapter 3, and thank you very much.